So it's essentially you got catastrophic coverage for the bad stuff. You got cancer, you got heart disease, you got that. But for smaller costs, you have this medical IRA. I've been pushing these things for 20 years. HMOs, insurance companies have come after me like banshees. Why? I mean, because the core of this is they make us better consumers of healthcare. It puts us back in charge of our healthcare finances. Not insurance companies, not HMOs, you. It brings direct incentives to consumers to control costs and stimulate market cost control competition. Right now, as consumers of healthcare, we're going to the healthcare grocery store and we're picking up a bag of peas and we're going to the checkout counter and the clerk says to us, "That'll be $5,000 for that bag of peas." And we go, "Well, the guy behind me has the credit card, so whatever." No, we got to stop doing that. I mean, I guess it's easier. It's a hell of a lot more expensive, but I guess it's lazy, but it's easier to do that. But if we take some personal responsibility in this thing, what we found is when HSAs are implemented, they maintain the quality of care, enhance consumer choice. You leave your job or you retire, it goes with you, and you empower the individual, heaven forbid. HMOs and insurance companies hate this. It doesn't empower them. A famous senator, and this is how long this battle's been going on, almost 20 years ago, took his finger and tried to put it through my chest, saying that I was one of the most dangerous people in America because what I talk about empowers people. And nothing could be worse for this country because people need government because government can make the decisions better than individuals can. I kid you not. The Mackinac Center, based in Midland, here in Michigan, concluded that minimum $200 billion a year would be saved in HSAs. We actually did an analysis here in Michigan. The Attorney General of Michigan, Cox, his guys called me up and said, you talk about this HSA thing, blah, blah, blah. We got 49,000 employees in the state of Michigan. If we put every employee in their family that works for the state on health savings accounts, can you run your numbers and figure this out as far as what this would save the state? Well, when it came down to it, they would have better insurance. They wouldn't have to pay a penny. I mean, this is without putting any co-pays, deductibles, anything in. The state would save $580 million every year. Now, who didn't like that? Who has the exclusive contract with the state of Michigan for their state employees? Blue Cross Blue Shield of Michigan. And all that $580 million goes right to their bottom line. By the way, interesting, Blue Cross Blue Shield is a nonprofit entity, but they have $2.5 billion in the bank. They lost their federal nonprofit status a number of years ago because the GAO, the Government Accounting Office, said, hey, you guys are not a nonprofit entity. But they're still nonprofit in the state of Michigan, but on a federal level they're not, other than the fact that in Obamacare there was a little portion put in for Blue Cross Blue Shield of Michigan, and when Obamacare goes into effect, guess who doesn't have to pay federal taxes for several years? Thank you, Senator Levin and Senator Stabenow. You can guess who funds their campaigns. Look at some companies that have used health savings accounts. Dominion Resources, 80% of their 200 employees enrolled within 1 year in health savings accounts. Their health care costs were diminished by 33%. Diminished. Now, I went to our office manager, and I said, okay, this is in 2009. I go, I've been doing this for over 20 years. I go, can you do an analysis for me and tell me when I started doing this in 1989, how much I got paid for a procedure, per procedure, and what I get paid now for the same procedure? She goes, okay. She came back a week later and she closes the door. She goes, sit down. I go, what? She goes, sit down. I go, why? She goes, you got to sit down. I go, okay. She goes, you know how you asked me to do that? I go, yeah. She goes, here's the deal. She goes, per procedure, in non-inflation adjusted dollars, you get paid 50% less today than you did 20 years ago per procedure. Yet our insurance premiums have gone up hundreds and hundreds of percent. So wait a minute. If I'm getting paid 50% less and all of our premiums are going up hundreds and hundreds of percent in that 20, where's it going? Take a guess. Insurance industry, administration. So the Rand Corporation, not exactly a conservative think tank, studied HSAs because they were going to blow them out of the water, and they actually found that the reduced expenditures were due to reduced optional services. Read that as nobody was getting plastic surgery done. Cost selection between providers. Hey, doc, where are we here with this cost? What can you do for me? And increased use of preventive care. Oh, imagine that, increased use of preventive care. I'm going to give you 2 examples. Both patients had the same condition. Both came to me on the same day. 99% of the folks I treat have a shoulder problem. First patient comes to me, was treated non-operatively for 6 months by his family doc, treated appropriately, still had problems, couldn't sleep, couldn't do things, a lot of pain. I examine him, he has a rotator cuff tear. I look at him and I go, you can continue your non-operative treatment, you can live with this, or you can have it fixed. And he looks at me and he goes, what about an MRI? I go, well, here's the deal. We're very confident that you have a rotator cuff tear. He goes, well, wait. He goes, I was watching Barbara Walters last night, and she said everybody should have an MRI that has a orthopedic condition. So I want an MRI. Okay. $800 to get it done, $800 to get it read, $1,600 later, he comes in, torn rotator cuff. He looks at me and he goes, fix it. Next person comes in to see me. Same problem, 6 months, non-operative treatment, same exam, and I hear, here are your options. You can live with it, you can continue your non-operative treatment, you can have it fixed, or actually there's another option based on the last guy who was here, because Barbara Walters talked about this last night on TV, we could get an MRI. And this guy had a health savings account. And he looked at me and he goes, how much does a MRI cost? $800 to get it done, $800 to get it read. He goes, all right. So we're going to spend $1,600, and we're going to not be any further down the road. All right. He goes, heck with that. No. He goes, now I got a question for you. What is the cost of you fixing my rotator cuff? I go, okay, pre-op visit, surgery, and 3 months of post-op care, $1,200. And he looks at me and he goes, will you do it for $1,000? Yeah. Well, one of the problems I have in talking about health savings account, a lot of docs don't want that because it makes them more accountable. They don't want to have that discussion. They got to learn they have to. It also makes docs more accountable to patients because guess what? If you're not forced to see a doc and that doc is a jerk, guess what? That doc's going to go out of business. And heaven forbid if you have to spend more time with patients, right? Because if you're not accountable, your business is going to dry up. It provides better quality care for people. That's what all the studies in HSA show. Golden Rule Insurance Company, they actually were the only insurance company that supported these HSAs. They had 90% of their 1,300 employees enrolled within a year. Their cost diminished by 40%. You kind of see a theme here between 30 and 40% cut in costs decreasing. And they increased their use of preventive care by 20%. I know of no other healthcare reform plan that I've studied over the past 25 years that increases the use of preventive care other than health savings accounts. When you look at all the data combined, 40% of people who signed up for HSAs were previously uninsured. And when you ask these people, why do you have an HSA when before you weren't uninsured, when you didn't have insurance? They said, because this is something I can afford. The other stuff I couldn't afford, this I can afford. Well, a lot of folks from the insurance industry say, wow, you got to have a lot of money to want to do this. Well, interesting, because 56% of the purchasers had incomes less than $15,000 per year. Okay. Bottom line is, when they looked at small businesses, and this figure has held up, HSAs cut insurance costs to the average small business by 42%. True in 2004, true in the most recent analysis from 2009. In 1993, I got a call from Washington. It was from Bob Dole's office. He was the Senate Majority Leader at the time. He said, Janda, I've heard you speak. You think weird. You think backwards, this whole prevention thing. Nobody else thinks this way. He goes, I need you to do that weird thinking analysis thing and look at this Hillary Care thing. And tell tell me what's right with it and tell me what's wrong with it. And just give me the facts, will you? Not the, I'm tired of all these people giving me rhetoric. Just give me facts, the way you do that analysis thing. So we did the analysis thing. We found a couple things that were good about it, but a lot of things that were bad about it. And that's what ended up being used to help, if you will, take apart Hillary Care. Now, I did that free of charge. I flew to Washington on my own. I didn't charge the government. I didn't get paid to do it. Paid a price, though. From that year, 1993, until 2000, my family and our business was audited by the IRS every year. And in fact, they knew our eldest daughter was born in 1988, and we had somebody that was helping take care of her during the day sometimes. And they went back all the way to 1988 and audited us. Now, I actually got to be kind of friends with the people in the IRS. I mean, they're hardworking people, and they got a tough job. And it turns out that, you know, my dad always used to say, when you're given lemons, make lemonade. So we got to know these folks, and every year they would find in our favor. It really pissed off the Clintons to an nth degree. So we'd always get a little money back. But when I talked to Senator Dole and showed him that this was not something good for our country and for every person or family or business in this country, I said, you know, you really need to push an alternative, and that's the health savings accounts. And he embraced it. But I said, Senator Dole, you gotta measure the results to see if it actually holds up over time. And before he left office, because he resigned his office to run for the presidency, he pushed this through. Now, it got watered down by a couple folks on the other side of the aisle who took big businesses out of it and just made it so that health savings accounts would have special tax exemptions if you had a company that had 50 fewer employees or were self-employed. But it's interesting, even with those restrictions, they started measuring in 2004. It went into effect in 2000. You know, government takes forever. They measured it for 4 years. And what they found is in 2004, 600,000 folks were enrolled in HSAs. By 2005, it went up to 4 million. By 2007, it went up to 14 million. In 2009, it's over 20 million people. So many people say, well, they don't really work. Well, then wait a minute. I mean, if it doesn't work, what's going on here? We're not a bunch of lemmings. It works because, I mean, more people are coming into the program because they see it as cost-effective, as putting people back in charge, not government officials, HMOs, insurance companies. Well, it's interesting. When they looked at the data through the Treasury Department that did the analysis, 31% of the people covered by HSAs were previously uninsured. Same answer as the other studies. This is something I can afford. 33% of small businesses now with HSAs previously did not have other insurance because they couldn't afford any other way. What do you think the health insurance industry thinks of me about health savings accounts? You know why? Do you know why they tried to block HSAs from being utilized in the insurance industry? You would think, wait a minute, wait, they're getting premiums. No. The administration cost with a standard insurance policy is over 30%. We've established that. The administration cost for HSAs, 1%. They hate it because they make far less money, even though it's what's right for you. HSAs, bottom line, provide health care freedom for every person, family, and business.